Are you eating something sweet and sugary right now? Put it down and watch. Welcome to the Pharmacist, where we delve into the intricate world of science. In today's video we will explore the sweet but sinister side of sugar, its detrimental effects on our health and the science behind its addictive nature. Let's start by uncovering the scientific truth behind the sugar hold on us. Sugar addiction isn't a myth, it's backed by science. But is sugar really as addictive as cocaine? To understand this comparison, we must first recognize that both sugar and cocaine affect the brain's reward system. When you consume sugar, it triggers the release of dopamine, a neurotransmitter associated with pleasure. Dopamine is responsible for making you feel good and happy, and it plays a pivotal role in addiction. However, it's essential to note that the effects of sugar and cocaine on the brain are not identical. Cocaine is a powerful stimulant drug that directly affects the dopamine system. It blocks the reuptake of dopamine, leading to an intense surge of this neurotransmitter in the brain. Cocaine is classified as a Schedule II controlled substance due to its high potential for abuse and addiction. It can lead to severe physical and psychological dependence. Sugar addiction, on the other hand, is characterized by behavioral and psychological factors. While it may not lead to physical dependence in the same way cocaine does, it can still be incredibly challenging to overcome. Sugar's impact on the dopamine system can create a craving and reward cycle. Over time, your brain becomes desensitized to this dopamine release, demanding even more sugar to achieve the same high. This is actually a vicious cycle that can be tough to break. The brain reward system becomes rewired with repeated sugar consumption, much like other addictive substances. Sugar addiction is a real phenomenon affecting both the brain and behavior. I reckon some of you have just searched in Google about the detrimental effects of sugar and is sugar really bad for our health, so we're now gonna explain this. Firstly, excessive sugar intake can lead to insulin resistance, a precursor to type 2 diabetes. It significantly affects our insulin sensitivity. When we consume sugary foods and beverages, our blood sugar levels skyrocket, triggering a release of insulin. Over time, repeated spikes in blood sugar can lead to insulin resistance, a condition where cells no longer respond effectively to insulin. All of this is a precursor to type 2 diabetes. Furthermore, as you all may know, sugar consumption is closely linked to obesity, as excess sugar is stored as fat in our body. This not only affects your appearance but also increases the risk of chronic diseases. The news gets even worse, as more adipose tissue means that our insulin sensitivity deteriorates over time. To understand this relationship, we need to start with insulin, a hormone produced by the pancreas. Its primary role is to regulate blood sugar levels by allowing cells to absorb glucose for energy. When insulin binds to its receptors on the cell's surface, it signals the cell to open up and take in glucose from the bloodstream. You can imagine as insulin is the key for the lock, which is the receptor, so insulin sensitivity refers to how well these insulin receptors work. In healthy individuals, cells respond efficiently to insulin signal, allowing for proper glucose uptake. However, in case of insulin resistance, the cells become less responsive to insulin messages. This means your body needs more insulin to get the same effect, leading to higher levels of insulin in the bloodstream. Another thing you should bear in mind is that obesity characterized by excess body fat is a significant contributor to the development of insulin resistance. So, adipose tissue or fat cells secretes inflammatory molecules that interfere with insulin signaling, reducing the sensitivity of cells to insulin. This creates a vicious cycle. So, obesity leads to insulin resistance, and insulin resistance can promote further weight gain. So, insulin is also involved in fat storage. When there is excess insulin in the bloodstream, it promotes the storage of glucose as fat in adipose tissue. Persistent insulin resistance can lead to type 2 diabetes, as body struggles to control blood sugar levels. Unfortunately, your liver also takes a hit. Excess sugar taxes the liver, leading to a condition known as non-alcoholic fatty liver disease, which can progress to more severe liver problems. The next thing will be the impact on heart health. Sugar's detrimental effects extend to our cardiovascular system. The cardiovascular system consists of the heart, blood vessels and blood working together to transport oxygen, nutrients and waste products throughout our bodies. Firstly, too much sugar can cause obesity. Secondly, obesity can lead to high blood pressure. Thirdly, sugar can disrupt the normal regulation of blood vessel tone, leading to stiffening and increased resistance, which elevate blood pressure. But you should bear in mind that beyond the immediate effects on blood sugar, sugar can also promote inflammation throughout the body. Inflammation damages the endothelial cells lining our blood vessels and impairs their ability to relax and contract properly. The chronic inflammation caused by excessive sugar consumption, along with the increased cholesterol level, can contribute to the development of atherosclerosis. This condition is the buildup of fatty plaque deposits within the walls of arteries, which narrows the vessels and restricts blood flow. Another bad effect of sugar is the tooth decay. The bacteria in your mouth feed on sugar, producing acids that erode your enamel. This leads to cavities and can eventually result in tooth loss, affecting not just your oral health but also your overall well-being. It's imperative that we take control of our sugar consumption. So, how can we reduce our sugar intake and break free from its addictive grip? Start by reading food labels to identify hidden sugars. Reduce your sugar intake gradually and choose whole unprocessed foods. It would be better for you to consume foods rich in protein, which can suppress your cravings for sweets and stabilize your blood sugar levels. Also, avoid to drink juices and beverages as they are full with processed sugars. Stop cooking with sugar and stop adding sugar in your coffee cup. Use erythritol or stevia instead. Don't use artificial sweeteners as they can be as detrimental as sugar for your health. Start consuming foods which are rich in complex carbohydrates such as pasta, rice, potatoes, oats, and eat as many vegetables as possible. The complex carbohydrates don't trigger an instant insulin response and keep us full for a longer time and help us avoid cravings for sweets. Stay informed and seek guidance from healthcare professionals to build a healthier relationship with sugar. So, armed with knowledge and determination, we can take control of our sugar consumption and lead healthier lives. I hope you enjoyed this video and type of content. If so, please like, share, subscribe and hit the notification bell for more videos like this.